Welcome, everyone. Welcome to this webinar that Infoway is hosting this afternoon on the ImagineNation eConnect Impact Challenge. Many of you are joining us from across the country, so we thank you for your time, and we hope that this session will answer a lot of your questions about participation in the eConnect Challenge. Here's our standard disclaimer. If you can read it at your own speed here, but basically we just want to tell you that this is the views of Infoway. It's informative only. We do not endorse any particular technology or product, and that's what we are showing you here. So moving on with today's agenda, after a couple of welcome and introductions, we'll get into actually telling you about the challenge and our challenges here at Infoway. Also, some information about some past challenges. We'll get into the overview of the eConnect challenge, and eventually we'll finish up with some questions and answers. As far as introductions, I'm Fraser Ratchford. I'm the Group Program Director of the Consumer Health and Innovation programs here at Canada Health Infoway. I'm also joined by my colleague Justin Noble. He also is in the Consumer Health and Innovation program. Justin is your key point person for anything challenge related. He'll be fielding your questions and letting me know about those questions during the course of this presentation. So welcome to Justin, and basically welcome to all of you who are joining us from across the country. So about ImagineNation challenges. So challenges are increasingly used in public and private sector. I don't know if any of you know this, but challenges do date back to about 1795 when the French military offered a prize to anyone who could preserve food. And as a result of that, today we have canned food. So that was a result of the challenge. The chronometer, private space flight are also results of challenges as well. And if you're sort of interested in looking at what other challenges exist, you may have heard things about the X Prize or Color Outside the Lines. The Royal Bank of Canada has the Next Great Innovator campaign, which is also a challenge. There's also the Grand Challenges in Canada, and also the U.S. General Services Administration has a whole federal department devoted to challenges. So at Infoway, we've adopted challenges to help accelerate the adoption and effective use of digital solutions. And we have found that this has been able to demonstrate the clinical value of these solutions, and we've done this through a series of challenges, of which the latest one, which we're here to talk about today, is the eConnect Impact Challenge. So the challenges seek to inspire and spread innovation in health and healthcare. Many of our past challenge participants have benefited from being part of our challenges. They've learned from others, they've shared their stories and their know-how, and of course they've shared in the awards and or glory from being noted as a challenge award recipient. While each challenge is different, they all share the common theme of this sharing of experiences and promoting the growth in use of effective use of digital health in Canada. Our first challenge was in 2011 when we began by asking Canadians for their best ideas to improve health and healthcare using information technology. This was the Ideas Challenge. Our top award happened to go to a physician who came up with an idea about sharing immunization information and schedules. Our Canada's Choice Award, so the one that Canadians voted on, went to the Niagara Regional Health Department, who has since created an app that is available on the App Store. And it was this Ideas Challenge that sparked them with this innovation. Our next challenge, the Outcomes Challenge, challenged healthcare organizations in four key technology areas. Those were e-scheduling, patient access to health information, clinical synoptic reporting, and medication reconciliation. And during the time of that challenge, we had over 3.6 million uses of those challenge solutions. If you're at all interested, there are videos available on our website describing the use of each of these solutions. Our most recent challenge, or the one that we had preceding the eConnect challenge, is our Impact series of challenge. We heard great stories from patients, individuals whose careers were impacted, and businesses that have been impacted by public investment in digital health. Again, I encourage you to go to our website to see these stories that have been shared. Some of them are very compelling. So, to the reason why you're here today is about the eConnect Impact Challenge. It's very similar to the Outcomes Challenge. We launched it and announced it in the fall, and basically the starting gun has just gone off this month and runs until March 2015. There are over $1 million in awards through the course of the challenge. The 4 categories for this particular challenge are e-visits, e-requests for prescription renewal or refill, e-request of services, and e-report of services. Within this challenge, there's also a capacity that participants build a quality plan to address issues arising from their survey, which is a quality component, and it's a system and use survey. So the users of your system will have the opportunity to complete these surveys, at which you will get the results and be able to reflect on those, create a quality plan, and at the end of the challenge, you'll also be able to write a short summary to reflect on the impact that changes you made to quality have had. Let me give you a little more description on the actual categories so that you can understand them. So an e-visit, basically that is a visit between a patient and a provider. The patient would be in their home, so that's the remote electronic aspect of it, and it can be a two-way asynchronous communication between the individuals. E-request for prescription renewal or refill, basically as it sort of says there, is the patient or consumer in this case would be able to request their prescription online to have it renewed or refilled. The e-request for services, this is a clinical one where basically clinicians should be able to request services. Examples of these would include things like e-referral or CPOE. In the e-report of services category, this would include things like a discharge summary being made available to another clinician for the purposes of patient care. So I hope we've clarified those particular categories for you, but when you think of it, why should you join the challenge? There's many reasons to join the challenge. First, to gain the opportunity to contribute solutions to important challenges that will improve health of Canadians and the patient's experience. We want teams to raise their profile as an organization, a solution that is innovative and delivering value to Canadians. By participating, we anticipate that you'll learn from a community of innovators. Again, as I said earlier, past participants in our challenge have found this very good. We've had webinars where teams explain the use of their solution and a dialogue between people who are using similar solutions so that they can learn from each other. Of course, there are the financial incentives that I've mentioned before, and there are also going to be access to a series of supporting resources. As I'm going along, please feel free to submit any questions online, and we will address them as we're going through the challenge, as we're going through the webinar. But of course, we are having a question and answer period at the end of this session. I've already explained the eConnect Impact Challenge categories. They're here for your reading. Also, we will make this presentation available on our challenge website and through the Infoway website, so if afterwards you want a chance to reread any of this material, it will be available to you. But again, basically the 4 categories are split up into 2 consumer categories and 2 clinically oriented categories. So some important dates to keep in mind. We already said as of January 1st, the challenge began, but it's never too late to enter. The challenge will run until March 2015 with some final challenge cleanup activities happening in the month of April. What are some dates coming up are the sooner you get in, the sooner you may be, the survey bonus may be applicable to you. So if you can get in, and then that particular award may be something that you can achieve. During the course of the challenge, we have other deadlines which relate to different awards that are available, and each of these awards have various monetary amounts attached to them. All of these are described on our website, www.imaginationchallenge.ca. So you're thinking about, well, I may have one of these solutions. What do I need to, what's a team? How do I actually join the challenge? So teams must have one or more sites, so either an organization or a delivery unit that delivers the services of regulated health providers in Canada, and they have to be using one of the 4 challenge categories, a solution in one of those categories. A team can include one or more people, and each team must designate a team leader who will support all of those members. And for us, that team leader is our key contact here at Infoway, and any information that flows between us and the team would normally occur through the team leader. If we have specific questions or need some clarification, we would contact the team leader. So how do you get started and how do you join? First of all, you need to visit the challenge website, ImagineNationChallenge.ca. If you want to quickly get to the eConnect pages, then you would include the /eConnect on the end of your URL. There are basically sort of 2 things you need to worry about. You want to qualify, and then after qualification, there's some regular information that you need to be aware of. In order to qualify, what you want to make sure is that you check your eligibility. On the website, we have clear eligibility criteria that says basically you need to be a regulated health provider, you need to be performing these services in Canada, and your solution needs to meet the criteria listed for that particular solution as we've defined it earlier. You register your team. On the challenge website, there is a registration page that allows you to fill in some demographic information about your team and some baseline information that we are collecting so that we can ensure that your solution meets the definition of the challenge. Once we've been able to confirm your participation in the challenge, you will receive a confirmation of your participation either through email or a phone call from the staff here at Infoway. Once you've qualified, then you can invite other team members as necessary. This is truly up to you. What we have found in the past is that various teams like to have that sort of camaraderie effect, and by inviting various team members, they can all see their progress and are all advancing to these potential awards. Also, if you have various sites, you may need to include team members from those sites who are going to be able to report data on your behalf. Speaking about data, you do need to track and report monthly your progress. And basically, there are only 2 items that you're tracking on a monthly basis: users and use. Some of the categories require less information than others, but if you just think of those 2 items, you'll be good to go. What is involved in this particular challenge is a quality aspect. And in order to do that quality aspect, you'll be provided a system and use survey link, and Infoway will host the survey, and you'll be sending it to your users in order for them to tell you about your solution. These are very short surveys. They're on our website, so you can get an idea of what questions will be asked. For the users, we think this will only take between 5 and 10 minutes at the most. You're distributing those surveys as a pre and post quality impact, and in order to do that, once you've done that, you'll submit a quality plan, and then post, you'll a quality impact report. Of course, along the way, you're going to learn and share from others and share the experiences that you've had. Each of these sort of after qualifying items that you need to do will attribute to different awards that are available. So when I earlier talked about the different deadlines, those you want to make sure you're aware of so that you're doing things in time so that you are able to compete for the various awards. So we're asking all of you to make the connection. So if you're connecting with your patients and or colleague providers, we think that you should be part of the eConnect Challenge. This challenge, as I said, runs until March 2015. It sounds like that's a long time away, but in order for you to have impact, we need to give you the time to ramp up and able to make that connection and impact with those patients and providers. So at this moment, I'd like to open up the floor to individuals who would like to ask questions about the challenge specifically. Justin here is moderating those questions now, and so as they come in, I will attempt to answer them. I may turn it over to Justin to answer some of them as well, but please send us your questions, and maybe Justin, you can give me the first question that's come in.
Sure, Fraser. So we have a question here. So the challenge has begun here January 1st. We're counting from now until March 2015. So if a team registers in January, this team is asking, will they lose a month of reporting for joining the challenge in January?
No. So during the month that you report, you can, or that you actually join and qualify, you can actually count that month to your overall totals that you're submitting to us on a monthly basis. So it's not too late to join any time in this month, and in fact, it's not too late to join up until March 2015. For those of you that are larger institutions, you know, you want the extra time to actually get more people, more uses, but a lot of these awards are based on percentage increase. And so once you give us that baseline, we will be judging, and the awards are based on your percentage increase in use. I hope that answers the question for that particular team.
There's a question here, Fraser. What if a team solution is implemented but there's not any users yet? Can they join the challenge? What we
ask for in this challenge is that you actually do have at least one user. That tells us that your solution is real and that it is in fact being used. So you need to have at least one use before you can be an official participant in this challenge. We know the intentions there that, you know, you may have implemented a solution but no one's used it yet, but we do want a use. And basically that use is if they are trained to use the system and ready to go.
The team asking that on the website it's mentioned that a video is required on YouTube showing the solution. Who's required for creating this, and is a vendor video appropriate?
So part of the reason that we ask for a video is so that we can verify that your solution actually exists. There are specific requirements in the rules that say that what the video contains, and there's a time limit as well. So for some teams, what they are doing is that they are sending us written documentation on some of the use of their how their system is being used. and supplementing that by a vendor video. And that is appropriate, but if you're not sending us any actual written documentation, you're probably going to need more than just a vendor video. If you look on our website for the Outcomes Challenge, you'll see that teams there submitted a variety of different videos. It's not actually that difficult. It does not need to be a commercial grade video, but it just helps us to make sure, and it is something that we will put on the website so other people can sort of learn from what you're doing in your particular institution. A video is not required for registration, no. However, if you are selected for any award, a video will need to be submitted by that time.
Thanks, Spencer. We have a question about how the prize money is distributed. So does it go to the organization or does it go to the team lead? What's the process for if a team is lucky enough to receive an award?
Should a team, when a team registers, they actually designate who the organization to receive the award amounts go to, and that is set right at the beginning. If a team comprises multiple organizations, we only issue any particular funds to the organization that was listed as part of the registration process when the team lead signed up. If you want to distribute your funds independently after we have given it to the organization that the team lead has put in as part of the registration process, that's each of the team's own, whatever they'd like to do with it. We're not involved in that process.
So is there a minimum number of uses required for a solution before March 31st of this year?
No, there's no minimum use other than one. You at least have to have one use so that you're on the go and that you actually know, we know you have a live working system, but otherwise there is not a minimum use. There are minimums used when we're actually calculating your percentage growth, however, but that does not impede you from participating in the challenge so it's not a specific minimum by March 31st, but we're actually calculating your growth. We start at a baseline number of 100 uses, I think across all 4 categories, Justin?
Yes.
Yeah. So we will, if you say to us, if by the, your baseline is 1, we will bump that up to 100 in anticipation that you're actually going to surpass that quite easily. Next question.
We have another question of what if Infoway has been involved in project funding for implementation of a solution? Does that disqualify a team from participating, or does that affect a team's ability to participate?
So in the instance of whether we've invested in a particular project in the past or present, it does not disqualify those organizations from participating in the eConnect Challenge. It does not bias our judges. Our judges are blinded to, it's not Infoway who is judging any of the written components or quality plans. It will actually be a panel of judges that we pick from across the country. And when it comes down to your numbers, i.e. what you're reporting, it doesn't matter whether we funded you or not. You're going to have to get the adoption and growth, spread and growth from your own users.
Okay. We have a question about who the team leader needs to be. So does the team leader have to be a clinician? Does it have to be someone who's a regulated health professional? Or can it be someone else on the team or even a staff member?
So the team leader does not need to be a clinician, although there needs to, we have to make sure that the team itself is an organization that is providing the services of regulated providers, and hence sometimes teams actually include a clinician on the team, but it's not necessary. The team leader, though, does have to be able to sort of attest on behalf of the organization. So as long as they sort of have maybe for ease of use, is saying some sort of signing authority, or that they can actually, say that they've been able to achieve the numbers that they've achieved and they're representing the organization in that respect, then that is sufficient to be a team lead. Did I miss anything on that definition, Justin?
No, and just to underline that the team leader can also invite other team members to join. So if the team leader who has a signing authority is designated as the team leader, they can still have a team member assist them with the operation of the team in terms of the challenge. So if there's team leader is the person with signing authority, the team member may be the one that actually reports month to month, though the team leader is still responsible for the team's actions in the challenge. So we have a question about the system in use survey. Some teams are interested in adding their own questions to the survey. Is it possible to modify or adapt the survey for their own use?
I guess we'd look at that on a case-by-case basis. So if you're looking to adapt the survey to add 1,000 questions, then I'd probably say the answer is no. If there's a couple of questions that may be tweaked for your benefit or to specifically drill down on certain things, we can certainly entertain that idea and expand the questionnaire as necessary.
Right, so we have a question about are there any regulations around a clinician who has built their own solution? That is, they are a team lead using their own technology. I'm not sure if they're referring to regulations or rules in the challenge, but maybe you want to address that?
Can you repeat the question?
Are there any regulations around a clinician who has built their own solution? So they're the team leader, but they're using their own technology.
Okay, so as long as that technology has been, meets all sort of requirements and any conditions imposed by various sort of regulation bodies in the particular jurisdiction that you're using it in, then it would be fine. So, I mean, a clinician can, for lack of better words, be a vendor of a solution, and that solution can be used. We'd want to make sure that solution meets all sort of legislation requirements such as privacy, that it's meeting all clinical sort of guidelines that are expected in a particular solution, that it means that the provider using it isn't sort of breaking any sort of scope of practice or anything like that in their particular use of that solution.
We have a question about whether Infoway will provide funding for the implementation of a solution.
So our challenges are not part of our specific investment programs, and so no, it's not, teams don't come into this with expecting to get funding for their initiative. That's why we say there has to be at least one user to be part of the challenge. That said, all people are encouraged to go onto the Infoway website and look at current investment opportunities that exist, either within, in this case, the consumer health or innovation programs that may impact their ability to join the challenge. So there may be funding sources other ways. However, specifically the challenge is not funding you to implement a solution. Also, I mean, it's in some ways, though, if you are a challenge recipient of some of our major awards, that may go a long way, but it's nothing that you can count on because you are competing with a variety of teams from across the country.
And can a team join in more than one category?
So certainly we encourage teams to join in as many categories as they want. So they can join in one or up to all 4 categories. The one thing they do need to make sure of is that if they do join a category, we want to just make sure that they're not double counting any particular kind of use in one system and also counting it in another. And I think the categories are specifically distinct enough that shouldn't occur, but we just want to flag that as an issue that so if you're counting it somewhere else, you can't count it again for a different category. So we're at the 30-minute mark, and the questions have actually slowed down now, so I'll give you one more minute to submit your last questions. Otherwise, we'll probably call this to a close. What I'd like to encourage you to do is go to the challenge website, ImagineNationChallenge.ca. Look at the information there on the eConnect Impact Challenge. If you have any questions regarding the challenge itself, you can email us at innovation@infoway.ca, and your questions will be answered. So that is a great mailbox for you to know about so that you can ask us specific questions. Also, don't hesitate to pick up the phone. Justin here is here to answer any questions that you have, so if you just call the Infoway number and ask for Justin Noble, he'd be happy to answer your questions and get you as part of a participating team on this challenge.
Another question has come in, Fraser. Does an e-visit require the physician to have live contact with the patient, or can it be an email-style online communication?
So it can certainly be the latter, so asynchronous communication, so it doesn't have to happen live, so to speak, but it can be a secure messaging type of environment where the patient initiate a question, and then the physician or clinician at another time would then respond back to that particular query by the patient. Okay, well, I'd like to thank everyone for participating in this webinar today. I hope we've answered your questions about what is the eConnect Challenge, how to participate. Participation is easy. There's 3 simple steps. We encourage you to sign up today, get us your information. You can be part of a good community of innovators from across the country, and we look forward to seeing each of you as a team in this challenge. So on behalf of Justin, myself, and the rest of the team here at Infoway, thank you.